from time to time, everyone could use a little tweaking. Sometimes a trip to the cosmetic counter will do the trick. You'd be surprised what the right shade of lipstick can do. But sometimes it's not quite that simple. Has your sex life lost its sizzle? Is losing weight a losing battle? Are you less patient and more stressed than ever before? Well, then maybe it's time for a midlife makeover. Not the kind you'd expect, though. I've invited two doctors from the Jefferson Myrna Brin Center of Integrative Medicine to share their unique prescription for improved health, relationships, and quality of life. What is the Great Life Makeover?
A roadmap for getting through the middle decades, living better, feeling better, functioning better, thinking better, and even looking better.
Well, now let's get into some of the specifics, starting with the one that everyone wants to hear about most, sex.
For correct sexual function, there are many layers. You have to have hormones. You have to have blood circulation. You have to have liver function. You have to have good neurological function. You have to have good psychological function. So when you sit with a person and try to help them for what they need, you have to go through all those layers.
There's also something in between good lifestyle that balances and regulates the hormones and needing a medical intervention, and that's thoughtful use of supplements. We recommend a product called Peak for Her by Lucentia, and for men, it's called Peak for Him. And this is a combination formulation that takes many of the variables that we're talking to into account and does a little more for you than what diet would do.
Well, now on to diet. You're proponents of a plant-based plan. Are you suggesting we all become vegetarians?
Animal products can have their role when it's thought out very carefully. For some people who are vulnerable, who have bad coronary artery disease, or who are really trying to change their health status, we are very cautious about how much in the way they consume of meat and especially dairy. And so a plant-based diet gives a lot of the basic nutrients that people are missing. We have an example of cruciferous vegetables like Brussels sprouts and those sort of crunchy vegetables such as broccoli, kale, cauliflower, arugula. The cruciferous vegetables have an extra value when we're talking about midlife health and hormonal health because they have a regulating effect on hormones for both men and women. So plant-based means that the majority of your dinner plate has vegetables, some whole grains. The minority has the other stuff.
We divide food in two main enormous categories. One is living food, and the other one is called dead food. What is living food? Living food is the food that when you eat it will give you life, will transfer the charge from the sun, the photons from the sun that trapped into this, and then you eat it and this will die for you. It will give up its life for yours and it will lift you up. On the other hand, when you open up processed dead food, it has nothing of that. It will give you calories, but it won't give you energy. You see, a lot of people are overfed and undernourished. They're overweight and always tired. So understanding the difference between food that will give you life and food that will take it away from you is enormous.
Well, now you have a bunch of different things on the table here. Explain them.
This is a sprout salad. Sprouts are extremely valuable in giving energy and life because they have a lot of it themselves.
The biggest question we're often asked is, what do we do about snacks? And so the trail mix is one of them. And
what's in that?
So we have a couple of fresh nuts, walnuts and almonds. They have very good nutritive value, and when you can get them raw, even better. We mix them with seeds and then just a few organic raisins to give the touch of sweet. And then I like to add some sea salt.
Now, you're also believers in taking supplements. In addition to a comprehensive multivitamin, what are some of your recommendations?
One of them is omega-3 fatty acids, often they come in the form of fish oil. We also have an example of a probiotic. They're actually bacteria, but they're the good bacteria. Those bacteria provide the barrier or the film between you and the outside world. So making sure that that bacterial balance is in check is important.
Well, now moving on to exercise.
Major studies have shown that fitness is even more important than how much body fat you have. So being lean and out of shape doesn't fare well in terms of longevity and long-term risk of diseases and overall health outcomes. So people should be as active as possible. Even a brisk walk 3 times a week has been shown to have enormous health benefits versus not doing anything.
Right.
We advise all 3.
Right.
Some muscle work, some aerobic work, stretching work. We're absolute fans of things like Tai Chi and Qigong.
Now, the final chapter in your book offers suggestions for mood makeovers.
How we feel affects our biochemistry. Getting enough sleep, lowering stress levels, all have a direct impact on susceptibility to infection and set up for things like type 2 diabetes, cardiovascular disease. So being kind to oneself, lowering stress levels. We try to provide a roadmap for how to do that, how to do all of the things we're talking about today in the book, and try to provide readers with the information that they need when they go to see their own doctors. Patients often go to the doctor looking for answers, but the doctor is focusing on what are your ailments, let's address those and move on. If people have the right set of information, they know the right questions to ask to make sure that they're also addressing their wellness and not just their disease status.
To learn more, check out greatlifemakeover.com.